So today we have a very interesting discussion, that is the hepatitis B markers. So there are three main markers, that is hepatitis B surface antigen, hepatitis B core antigen, and hepatitis B E antigen, which usually indicates infectivity. Now, what are these three different markers? So hepatitis B surface antigen is the most commonly used marker in hospital setting. So this is very commonly done pre-operatively to see whether any patient is infected with hepatitis B or not. So this is one of the most common marker for hepatitis B, which is used in the hospital as a screening protocol. Because if the patient is hepatitis B surface antigen positive, then definitely patient's liver function test, hepatitis B DNA viral load, these things are very commonly seen. And the second thing is, for pre-operative procedure or such patients who are hepatitis B surface antigen positive are usually kept at last in that day for the operative procedures, because to prevent the infections of other patients, and very commonly to protect the staff, hospital staff, paramedical staff, from getting infected from hepatitis B. So this is the first marker that appears in the blood, and usually if it is an acute hepatitis B infection, this hepatitis B surface antigen should disappear within 2 to 6 months. So, most of the time, if it disappears within 6 months, we can say that the patient is cured of hepatitis B. But if it persists by more than 6 months in any patient, then we call it as a chronic carrier for hepatitis B. So, such patients are then meant to give antiviral drugs, and such patients are then need to very regularly monitor for liver function test and hepatitis B DNA viral load. So, if it disappears within 6 months, then we can say that the patient doesn't carry hepatitis B at all. So, hepatitis B surface antigen is one of the most important marker which comes earliest, which is the first marker. And if the patient is hepatitis B chronically infected patient, then this markers, hepatitis B surface antigen, remains in the blood for rest of the life. So this is the antigen which is most commonly detected in hospital setting and is very commonly evaluated, or it is a screening method. So if we have around 6 to 7 tests for hepatitis B, which are carried all over India or all over world, hepatitis B surface antigen is most commonly run test, or it is most commonly used screening test to see whether someone has hepatitis B or not. So the second antigen is hepatitis B core antigen. Now this core antigen is actually not demonstrable. So we don't have a test which can actually diagnose the hepatitis B core antigen, but we can diagnose this on the basis of anti-hepatitis B core antigen antibody. So it can be IgM or it can be IgG. So we actually cannot see this, but we can see an antibody which actually binds to this antigen. And this is that antibody which is called anti-hepatitis B core antigen antibody, and it can be either M or G. So very commonly we use this antibody to see whether this infection is recent, or it is remote, or is it acute, or is it chronic. So, if it is recent or acute, then IgM remains positive. But if it is like chronic infection against which the immunity has developed, then we say that it is that patient has already infected and has already developed antibodies, means already developed immune response against the hepatitis B. So, this is how we utilize hepatitis B core antigen, which the core antigen cannot be detected by any test, but the antibodies against it can be used. And the third antigen is hepatitis B E antigen. Now this hepatitis B E antigen is very important. It usually appears along with hepatitis B surface antigen. So usually surface antigen appears first and then appears usually hepatitis B E antigen. Now, whenever a patient is positive with hepatitis B E antigen, it means the patient is highly infective. So it means his blood may have a significant high load of hepatitis B virus. So the viral load can be really high, and it usually indicates active viral replication. So this presence of hepatitis B E antigen suggests that the patient is in highly infective state, and same way or in the same reciprocal way, if the patient has antibodies against this hepatitis B antigen, then we can say that the patient infectivity is very low because anti-HAV antibody will simply clear the HBe antigen and it will reduce its infectivity. So, coming to anti-hepatitis B surface antigen, it usually appears as soon as the hepatitis B surface antigen starts reducing in the body, in the blood, means the body moves toward getting cured from the hepatitis B infection. And most of the time, this remains positive for rest of the life. And this is the hepatitis B surface antigen antibody is protective antibody. It protects from the hepatitis B for the remaining life of the patient. Second thing is this anti-hepatitis B core antigen antibody is the one of the first marker, the first antibody to come into the system. And as I told earlier also that initially it is IgM, and as day passes, after around 2 to 6 months, this IgM gets converted into IgG, and this tells that if it is IgM which is positive, it tells that the infection is recent, and if it is IgG, it tells that the patient had hepatitis B infection and the patient has recovered from the infection and it has developed immunity against the hepatitis B infection. And if the third antibody is anti-hepatitis B E antigen antibody. If it is positive, it gives you the implication that there is low infectivity of the infection. It means there is lower inflammation of the liver. It means that the patient is in better condition. Exactly opposite is hepatitis B E antigen. Because if only E antigen is positive in absence of the antibodies against it, it usually indicates the high infectivity, so high replication and high damage to the liver. So overall, when it comes to decoding the presence of this antibodies and this, what we can say, if someone has surface antigen positivity and E antigen positivity, then along with anti-core antibody, anti-core antigen antibody, this means the patient has acute hepatitis B infection. And there is infection is there because this is positive, and as E antigen is positive and antibody against the E antigen is not there, it means patient is highly infectious. Means this is an acute hepatitis B infection. Very simple. Second thing, suppose patient's surface antigen is positive, means patient is infected with the infection. Patient's hepatitis E antigen is also positive, it means infectivity is there. And if patient has anti-HBc antibody, if it is IgG, What does it mean is, as the IgG is already positive against the core antibody, it means that the patient had infection earlier in the remote past, and still the surface antigen is positive, means hepatitis B virus is still active. And as E is also positive, means the patient is still in highly infective state. Means this patient is basically a chronic hepatitis B virus state, and the patient has high infectivity. This is the meaning of this. The third scenario, which very commonly get, is suppose someone has hepatitis B surface antigen positive, means infection is there. Second thing, his hepatitis B E antigen is not there, it is negative, means automatically the patient will not be infective. Patient will not be infective. And if the patient has this anti HBc antigen antibody, and if it is IgG, what does it mean? That infection is there for sure. It means the patient is chronic carrier, but the infectivity is not there. So patient is non-infective. So we can call it as a carrier state. The next possibility that we can get is, suppose hepatitis B surface antigen is negative. The same way hepatitis B E antigen is also negative. But if the patient is positive with anti-hepatitis B core antigen antibody, so as soon as this antibody is positive, as soon as it is, and if it is IgM, it means the patient has recently developed antibodies and patient has cleared this both the antigen. It means that the patient recently had hepatitis B infection, but it is cleared by the body. So it means the patient is in very much better state. This is the implication of this. The second thing is, when the patient has hepatitis B antigen, if it is not there, hepatitis B E antigen is also not there, but core antibody is present, but now this time it is IgG. It means that patient had infection in a remote state, means maybe few years back, 10 years back, 20 years back, the patient had this hepatitis B infection, and the patient is not at all infective, or patient is protected. So in that scenario, if the patient has hepatitis B surface antigen antibody is positive, this gives protection against the damage. So in nutshell, patient must have anti-hepatitis B surface antigen antibody to protect themselves from hepatitis B. These are the protective antibodies. And most of the time, the easiest marker, the commonest marker, the screening marker which is used is hepatitis B surface antigen, which is usually the first marker to appear in the blood, and hepatitis B E antigen suggests the infectivity. Positive is the antigen, high is the infectivity, negative is the antigen, and lesser or nil is the infectivity. The only last thing which is remaining is, if patient has only anti-hepatitis B surface antigen antibody, that is the antibody against this antigen, this is the state which follows hepatitis B virus vaccine immunization. So someone gets hepatitis B vaccine. In that, what we give is the surface antigen. So against this surface antigen, the antibodies are developed, which are anti-hepatitis B surface antigen antibody. This gives protection against hepatitis B. So it simply means, in absence of hepatitis B surface antigen, hepatitis B E antigen, anti-HBc antigen, only presence of anti-HBs antibody, it tells that the patient has received hepatitis B vaccine and patient has now immunity against hepatitis B virus. So this is for all for today, and thanks for your listening.